Question 1. A client named Mrs. Thompson, who is 72 years old, was referred for occupational therapy due to her recent diagnosis of early-stage Alzheimer's disease. During her initial assessment, she is found to have difficulty with memory, executive functioning, and maintaining focus. Mrs. Thompson expresses frustration over her inability to complete daily tasks and her increasing reliance on her daughter for assistance. Occupational therapist, you are tasked with developing an intervention plan to help Mrs. Thompson maintain independence in her home. Which of the following strategies would be most effective in promoting Mrs. Thompson's independence? A. Focusing solely on physical exercise to increase her strength and stamina. B. Incorporating cognitive training techniques to improve her memory and problem-solving abilities. C. Encouraging her to move into an assisted living facility to reduce the strain on her daughter. D. Encouraging her daughter to assume full responsibility for managing Mrs. Thompson's daily routines. Answer. B. Incorporating cognitive training techniques to improve her memory and problem-solving abilities. Explanation. The most effective intervention for Mrs. Thompson would be to incorporate cognitive training techniques which are designed to improve memory, attention, and executive functioning in individuals with Alzheimer's disease. This approach aligns with evidence-based practices for dementia care and supports Mrs. Thompson in maintaining her skills, which in turn helps her maintain independence in her daily life. Cognitive interventions such as memory aids, e.g. calendars, reminders, and training for executive functions, e.g. planning and decision-making, can be crucial in managing the symptoms of Alzheimer's. Option A is not ideal because, while physical exercise is beneficial, it does not directly address the cognitive challenges associated with Alzheimer's disease. Option C is premature and may not respect Mrs. Thompson's desire for independence. Assisted living should be considered only after other interventions have been explored. Option D would undermine Mrs. Thompson's autonomy as it involves her daughter taking full responsibility rather than encouraging Mrs. Thompson to engage in strategies that support her independence. Question 2. Mr. Adams is a 45-year-old man who was recently diagnosed with a moderate traumatic brain injury (TBI) following a motor vehicle accident. His assessment reveals significant impairments in his executive functions, particularly in organizing tasks and maintaining attention. Mr. Adams also reports feeling frustrated and overwhelmed by the number of tasks he needs to complete daily. As his occupational therapist, are developing an intervention plan that will address both his cognitive and emotional challenges. Which of the following interventions would be most appropriate for Mr. Adams to help him regain functional independence? A. Using a structured routine and external memory aids, e.g. calendars, to-do lists to support organization and attention. B. Providing passive exercises that promote relaxation and reduce anxiety without addressing cognitive challenges. C. Focusing on emotional regulation by encouraging him to suppress his frustration and focus on task completion. D. Suggesting that he take long breaks throughout the day to avoid overstimulation and fatigue. Answer A. Using a structured routine and external memory aids, e.g. calendars, to-do lists to support organization and attention. Explanation. For individuals with traumatic brain injury (TBI), it is critical to use structured routines and external aids to address cognitive impairments such as issues with organization and attention. Memory aids, such as calendars, to-do lists, and reminder systems, are well-supported interventions that individuals with TBI stay on track with daily tasks. These aids provide external structure, compensating for the deficits in cognitive function and promoting independence. Option B is ineffective because passive exercises do not directly address the cognitive deficits caused by OBI. Option C is problematic because suppressing frustration without addressing the underlying cognitive challenges may lead to further emotional distress. Emotional regulation is important, but not the primary focus in this case. Option D suggests a passive approach that may not effectively engage Mr. Adams in task completion. Long breaks could contribute to reduced productivity and may not be a sustainable solution to managing cognitive challenges. Question 3. In your practice as an occupational therapist, you are working with a 6-year-old child named Emily who has been diagnosed with autism spectrum disorder. As Emily has difficulty with sensory processing, particularly with tactile defensiveness, making it difficult for her to tolerate certain textures of clothing and engage in group activities that require touch. During your assessment, you observe that Emily often becomes distressed when she is exposed to certain tactile stimuli, and this disrupts her ability to participate in school and play activities. Which of the following interventions would be most appropriate for Emily's sensory processing difficulties? A. Gradually introducing her to different tactile stimuli through sensory diet and desensitization techniques. B. Encouraging her to avoid any tactile stimuli altogether to prevent further distress. C. Focusing on improving her fine motor skills without addressing the sensory issues directly. D. Ignoring her tactile defensiveness and encouraging her to engage in group activities regardless of discomfort. Answer: A. Gradually introducing her to different tactile stimuli through a sensory diet and desensitization techniques. Explanation: For children with sensory processing difficulties, particularly tactile defensiveness, a gradual and controlled approach to exposure can help them become more tolerant of various textures and sensory experiences. The sensory diet, which involves structured activities designed to provide appropriate sensory input, can support a child in gradually becoming desensitized to certain tactile stimuli. The use of desensitization techniques is backed by research and can improve the child's ability to tolerate sensory input over time, thus promoting participation in daily activities like school and play. Option B is counterproductive because avoiding tactile stimuli entirely may reinforce the child's sensory defensiveness and prevent progress in overcoming the difficulty. Option C is insufficient, as focusing on fine motor skills without addressing the underlying sensory issues would not resolve Emily's challenges with tactile defensiveness. Option D is inappropriate, as it disregards the child's sensory needs and could lead to increased distress and avoidance behaviors. It is important to address sensory difficulties in a structured and supportive manner rather than forcing exposure to discomforting stimuli. Question 4. MS Rivera's a 38-year-old woman who was recently diagnosed with multiple sclerosis MS. She is experiencing fatigue, muscle weakness, and some cognitive difficulties. Her goal is to remain as independent as possible while managing her symptoms. During your assessment, she expressed a desire to continue working as an administrative assistant, but is concerned about her ability to manage the physical demands of her job, such as prolonged sitting and occasional lifting. Which of the following interventions would be most appropriate to help MS Rivera continue working while managing her symptoms? A. Recommending that she stop working to avoid any further physical strain. B. Modifying her work environment to allow for frequent rest breaks, ergonomic seating, and assistive devices for lifting. C. Suggesting that she take a leave of absence from work until her symptoms improve. D. Encouraging her to push through the fatigue and muscle weakness to maintain productivity. Answer: B. Modifying her work environment to allow for frequent rest breaks, ergonomic seating, and assistive devices for lifting. Explanation: For individuals with multiple sclerosis, managing fatigue and muscle weakness through modifications in the work environment is crucial. By implementing ergonomic seating, assistive devices for lifting, and frequent rest breaks, MS Rivera can reduce physical strain and continue her job tasks, preserving her energy and maintaining independence. This approach supports her ability to stay employed and avoid exacerbating symptoms, promoting occupational participation. Option A is not appropriate because it suggests discontinuing work entirely, which may limit MS Rivera's autonomy and negatively affect her quality of life. Option C is unnecessary unless other interventions to modify her work environment are ineffective. Taking leave of absence is last resort after exploring accommodation options. Option D disregards the impact of fatigue and weakness, which could worsen MS Rivera's condition and lead to more severe physical and cognitive issues. Question 5. Mr. Gonzalez, a 60-year-old man, was referred for occupational therapy following a hip replacement surgery. His rehabilitation progress has been slow due to his comorbid conditions, including obesity and hypertension. He reports difficulty with activities of daily living adults, particularly with dressing and bathing. Which of the following interventions would be most beneficial for improving Mr. Gonzalez's adult performance during initial stages of his recovery? A. Focusing solely on strengthening his lower extremities to improve his mobility. B. Teaching adaptive techniques and providing assistive devices for dressing and bathing tasks. C. Encouraging Mr. Gonzalez to perform adults independently without modification as long as he tolerates the activity. D. Recommending that Mr. Gonzalez discontinue certain adults until his strength and mobility improve significantly. Answer: B. Teaching adaptive techniques and providing assistive devices for dressing and bathing tasks. Explanation: During the early stages of recovery from a hip replacement, it is essential to provide adaptive techniques and assistive devices to support the client in performing adults safely and independently. For Mr. Gonzalez, using devices such as reaches, dressing sticks, and shower chairs can reduce the strain on his recovering hip joint and allow complete activities like dressing and bathing with greater ease. These interventions are practical and immediately applicable, promoting his independence and confidence in daily routines. Option A is valuable for long-term rehabilitation but does not address the immediate adult difficulties Mr. Gonzalez is facing. Option C may place Mr. Gonzalez at risk of further injury and should not be recommended without taking appropriate precautions. Option D is not ideal as it suggests avoiding necessary adults entirely, which could reduce Mr. Gonzalez's overall independence and quality of life. Maintaining engagement in routine activities is critical to recovery and maintaining overall well-being. Question 6. MS. Lee is a 40-year-old woman with a history of anxiety and depression. She has been receiving occupational therapy to help her manage daily tasks and improve her emotional regulation. During the therapy session, she expresses difficulty focusing on tasks and feels overwhelmed by even simple daily activities. MS. Lee has been prescribed medication to address her symptoms, but she still struggles with motivation and energy. What would be the most appropriate intervention to support MS? Lee's emotional and occupational well-being. A. Encouraging MS. Lee to focus exclusively on medication management and reduce her therapy sessions. B. Implementing a graded approach to task completion, starting with small, manageable goals to build momentum. C. Suggesting that MS. Lee reduce her daily activities until her mood improves significantly. D. Providing a strict routine for MS. Lee demanding she follow it regardless of her emotional state. Answer B. Implementing a graded approach to task completion, starting with small, manageable goals to build momentum. Explanation. A graded approach to task completion is an evidence-based method for addressing emotional difficulties in clients with anxiety and depression. By starting with small, manageable goals and gradually increasing the difficulty or duration of tasks, MS. Lee can build a sense of accomplishment and self-efficacy. This approach helps regain motivation and energy without overwhelming her, while promoting active engagement in daily activities. Option A would neglect the important role of therapy in supporting emotional regulation and occupational functioning. Medication alone is not enough without therapy and other supportive interventions. Option C might lead to a cycle of inactivity and dependency, which could worsen symptoms of depression. Activity engagement is vital for managing depression. Option D would not be appropriate as it lacks flexibility and fails to consider MS. Lee's emotional state, which could lead to increased frustration or a sense of failure. Question 7. Mr. Peterson is a 70-year-old man with Parkinson's disease experiencing significant motor impairments including tremors, rigidity, and bradykinesia. He is having difficulty with his instrumental activities of daily living adults, such as managing medications and preparing meals. Mr. Peterson is independent with basic activities like dressing and grooming, but struggles with tasks that require fine motor skills and coordination. Which of the following interventions would be most effective in improving Mr. Peterson's ability to manage idols? A. Teaching Mr. Peterson to avoid performing idols and rely on his family members for assistance. B. Implementing compensatory strategies, such as using large button medication dispensers and adaptive utensils for meal preparation. C. Encouraging Mr. Peterson to continue performing idols without any modifications to maintain his independence. D. Recommending that Mr. Peterson discontinue all idols until his motor symptoms improve significantly. Answer B. Implementing compensatory strategies, such as using large button medication dispensers and adaptive utensils for meal preparation. Explanation. Compensatory strategies are critical in addressing the motor impairments associated with Parkinson's disease. Adaptive tools such as large button medication dispensers, specialized utensils, and assistive devices for meal preparation can make a significant difference in Mr. Peterson's ability to manage his idols independently. These strategies are practical and promote his continued engagement in daily tasks without overburdening him physically. Option A is not ideal because it encourages dependency on others, which could reduce Mr. Peterson's autonomy and independence. Option C does not account for the need to modify tasks based on Mr. Peterson's motor impairments. Continuing without modification may lead to frustration or failure. Option D is premature and disregards the importance of adapting idols to maintain functionality and quality of life, even in the presence of motor impairments. Question 8. MS. Robinson is a 55-year-old woman who was recently diagnosed with rheumatoid arthritis (RA). She reports pain and swelling in her hands, making it difficult to perform tasks such as typing, cooking, and opening jars. MS. Robinson is also concerned about her ability to continue working as a receptionist due to these limitations. Which of the following interventions would be most appropriate for MS Robinson to address her occupational performance concerns? A. Recommending that MS Robinson stop working and take early retirement due to her RA symptoms. B. Teaching MS Robinson joint protection techniques and providing adaptive equipment for work-related tasks. C. Encouraging MS Robinson to push through the pain and continue working without modification. D. Suggesting that MS Robinson reduce her work hours significantly to avoid exacerbating her symptoms. Answer: B. Teaching MS Robinson joint protection techniques and providing adaptive equipment for work-related tasks. Explanation: Joint protection techniques are essential for individuals with rheumatoid arthritis to prevent further joint damage and manage pain. Adaptive equipment, such as jar openers and specialized keyboards, can also help MS Robinson maintain her occupational performance at work without exacerbating her symptoms. These strategies promote independence and allow her to continue her work as a receptionist, thereby enhancing her quality of life. Option A is not appropriate as it suggests an unnecessary lifestyle change without exploring interventions to maintain her current work role. Option C could lead to increased pain and potential long-term joint damage, making it an ineffective solution. Option D is not sufficient if it doesn't address the underlying issues and may not provide the necessary tools for managing the symptoms effectively. Question 9. Mr. Harris is a 58-year-old man recovering from a stroke. He has hemiplegia on the left side of his body, which affects his ability to perform daily activities such as dressing and meal preparation. He expresses frustration about not being able to return to his previous level of independence, and he is concerned about his ability to drive again. Which of the following interventions would be most beneficial in promoting Mr. Functional independence and self-efficacy? A. Advising Mr. Harris to avoid engaging in any tasks that require the use of his left side to prevent further frustration. B. Implementing compensatory strategies and adaptive equipment for dressing, meal preparation, and other idols. C. Encouraging Mr. Harris to immediately resume driving, even with limited use of his left side, to maintain his independence. D. Suggesting that Mr. Harris stop trying to complete any activity independently and rely on caregivers for all tasks. Answer: B. Implementing compensatory strategies and adaptive equipment for dressing, meal preparation, and other idols. Explanation: Compensatory strategies and adaptive equipment are crucial for promoting independence in individuals with hemiplegia. Devices such as one-handed button hooks, modified utensils, and adaptive tools for meal preparation can enable Mr. Harris to perform tasks more easily and safely, helping him maintain dignity and independence. These interventions empower the client to be more self-sufficient while promoting functional recovery. Option A is not appropriate because it suggests avoiding activities that can improve function and independence. Option C is not safe as resuming driving immediately without consideration for his physical abilities could be dangerous. Option D encourages learned helplessness and dependency, which would not promote his independence or self-efficacy. Question 10. Mrs. Green is a 72-year-old woman with a history of chronic obstructive pulmonary disease (COPD). She reports experiencing shortness of breath with even minimal exertion and is worried about her ability to perform household chores and engage in physical activity. Which of the following interventions would be most effective in helping Mrs. Green improve her ability to manage daily activities? A. Recommending that Mrs. Green reduce all physical activity to avoid worsening her symptoms. B. Teaching Mrs. Green energy conservation techniques and adaptive equipment to minimize physical exertion during activities. C. Encouraging Mrs. Green to push through a shortness of breath and complete tasks at her normal pace. D. Suggesting that Mrs. Green hire help for all household chores and avoid any physical activity. Answer: B. Teaching Mrs. Green energy conservation techniques and adaptive equipment to minimize physical exertion during activities. Explanation: Energy conservation techniques and adaptive equipment are essential for individuals with COPD to minimize fatigue and avoid exacerbating shortness of breath. Teaching Mrs. Green how to pace herself, use proper body mechanics, and incorporate rest breaks can help her maintain a sense of independence while managing her symptoms effectively. Additionally, assistive devices like a reacher or grab bars can reduce the strain on her body. Option A is not recommended because complete inactivity could worsen Mrs. Green's overall health and functional status. Option C could lead to overexertion and an increased risk of exacerbating her COPS symptoms. Option D may lead to loss of independence and does not support the goal of improving Mrs. Green's function through adapted techniques. Question 11. Mr. Thompson is a 50-year-old man with a history of chronic low back pain. He works as a truck driver and reports frequent difficulty sitting for long periods of time, which negatively affects his ability to perform his job. He is also concerned about his ability to maintain good posture while driving. Which of the following interventions would be most appropriate to address Mr. Thompson's concerns? A. Recommending that Mr. Thompson switch to sedentary desk job to avoid back strain. B. Providing ergonomic adjustments to Mr. Thompson's truck seat and teaching him posture management techniques. C. Encouraging Mr. Thompson to drive without brakes as long as he uses over-the-counter pain medication for relief. D. Suggesting that Mr. Thompson take leave of absence from work until his pain resolves. Answer. B. Providing ergonomic adjustments to Mr. Thompson's truck seat and teaching him posture management techniques. Explanation. Ergonomic adjustments to Mr. Thompson's truck seat, such as lumbar support, adjustable seat height, and proper positioning, combined with posture management techniques, will help him reduce strain on his back and maintain better alignment during long drives. Educating him about posture and incorporating frequent breaks will also improve his ability to perform his job while minimizing pain. Option A does not address the root cause of his back pain and unnecessarily limits his career options. Option C may mask the pain temporarily, but does not solve the underlying issue, and continuous driving without brakes could worsen the pain. Option D may not be necessary if adaptive strategies can help Mr. Thompson maintain his job and manage his symptoms. Question 12. MS. Anderson is a 35-year-old woman who recently gave birth to her second child. She is experiencing difficulty adjusting to her new role as a mother due to fatigue, anxiety, and a lack of support. MS. Anderson reports difficulty managing household tasks, such as cooking, laundry, and keeping up with her toddler. Which of the following interventions would be most effective in improving MS? Anderson's ability to cope with her responsibilities. A. Encouraging MS. Anderson to ignore her fatigue and perform all tasks independently to demonstrate her competence. B. Teaching MS. Anderson relaxation techniques and time management strategies to reduce stress and prioritize tasks. C. Suggesting that MS. Anderson stop managing household tasks altogether and hire full-time help. D. Recommending that MS. Anderson focus solely on caring for the baby and neglect all other responsibilities. Answer. B. Teaching MS. Anderson relaxation techniques and time management strategies to reduce stress and prioritize tasks. Explanation. Relaxation techniques and time management strategies are essential for helping MS. Anderson manage her stress and fatigue effectively. By prioritizing tasks and learning how to manage her time and energy, she can balance caring for her newborn and toddler while maintaining household responsibilities. These techniques can also help her improve her emotional well-being and promote self-care. Option A is not recommended because ignoring fatigue and doing everything independently could lead to burnout and exacerbate stress. Option C is not the most cost-effective or sustainable solution, and MS. Anderson would benefit more from developing skills to manage her own responsibilities. Option D may lead to an imbalance as MS. Anderson needs support in all areas of life, not just caring for her baby. Question 13. Mr. Williams is a 45-year-old man who recently had a below-the-knee amputation due to diabetes-related complications. He is preparing for prosthetic training and wants to return to his job as a construction worker. Mr. Williams expresses concerns about his ability to perform the physical tasks required at work, such as lifting, climbing, and walking on uneven surfaces. Which of the following interventions would be beneficial in helping Mr. Williams transition back to work? A. Advising Mr. Williams to stop working as a construction worker and seek a less physically demanding job. B. Providing prosthetic training and developing a plan for task modifications at work, including the use of assistive devices. C. Encouraging Mr. Williams to perform his previous work tasks without modifications to regain his strength and endurance. D. Suggesting that Mr. Williams take an extended leave of absence from work until fully healed and comfortable with his prosthesis. Answer. B. Providing prosthetic training and developing a plan for task modifications at work, including the use of assistive devices. Explanation: prosthetic training, along with task modifications, is essential to help Mr. Williams return to work successfully. It is important to ensure that he is properly fitted for a prosthesis and understands how to use it to perform tasks safely. Task modifications, such as using lifting aids or changing work environment to accommodate his prosthetic limb, will also help him perform his job duties effectively. Option A is premature and may limit Mr. Williams' potential to return to his original job with proper accommodations. Option C could lead to injury or fatigue, as he may not yet have the strength or ability to perform certain tasks without modifications. Option D is not ideal unless other options for returning to work have been explored, as it suggests avoidance instead of adaptation. Question 14. MS. Carter is a 60-year-old woman who recently underwent hip replacement surgery due to osteoarthritis. She is eager to return to her active lifestyle, including walking her dog and gardening, but she is concerned about her mobility and pain levels during rehabilitation. Which of the following interventions would be most appropriate to help MS Carter achieve her goals and promote recovery? A. Recommending that MS Carter avoid any physical activity for several months to allow her hip to heal. B. Developing a gradual exercise program that includes strengthening, flexibility, and balance exercises with progression as tolerated. C. Encouraging MS Carter to perform high-intensity activities immediately to build strength and prevent stiffness. D. Suggesting that MS Carter only engage in passive range of motion exercises, avoid weight-bearing activities. Answer B. Developing a gradual exercise program that includes strengthening, flexibility, and balance exercises with progression as tolerated. Explanation: a gradual exercise program that includes strengthening, flexibility, and balance exercises is critical for MS Carter's recovery after hip replacement surgery. This approach will help her regain strength, improve mobility, and increase her ability to perform daily activities. Progression based on her tolerance will ensure that she avoids overexertion and promotes safe recovery. Option A is not recommended because complete inactivity could lead to stiffness and functional decline. Option C is too intense for someone recovering from surgery and could increase the risk of injury or complications. Option D limits functional recovery and doesn't provide the intensity required to improve mobility and strength. Question 15. Mr. Nelson is a 45-year-old man who works as an office manager. He has been diagnosed with carpal tunnel syndrome, CTS, and reports tingling and numbness in his right hand, particularly after typing for extended periods. He is concerned about the impact of his condition on his work and daily activities. Which of the following interventions would be most effective in managing Mr. Nelson's symptoms? A. Advising Mr. Nelson to avoid using his hand altogether and take leave of absence from work. B. Recommending wrist splints, ergonomic workstation adjustments, and breaks to reduce strain on the wrist and hand. C. Encouraging Mr. Nelson to push through the pain and continue typing without any adjustments. D. Suggesting that Mr. Nelson engage in heavy lifting exercises to strengthen the hand and alleviate symptoms. Answer: B. Recommending wrist splints, ergonomic workstation adjustments, and breaks to reduce strain on the wrist and hand. Explanation: wrist splints, ergonomic adjustments, e.g. keyboard height, mouse positioning, and regular breaks are crucial for managing carpal tunnel syndrome. These interventions reduce strain on the median nerve, alleviate symptoms, and prevent further deterioration of the condition. Education on proper posture and wrist positioning is also important for symptom management. Option A is not ideal because it promotes complete inactivity, which is unnecessary and could reduce work performance. Option C could lead to further damage to the wrist and exacerbate symptoms. Option D is not appropriate because strengthening exercises might not address the primary cause of CTS, which is nerve compression. Question 16. Mr. Davis is a 55-year-old man who recently suffered a stroke resulting in partial paralysis of his left arm and leg. He is undergoing rehabilitation and is working on regaining the ability to walk and perform basic tasks such as eating and dressing. He is frustrated with his progress and expresses a desire to return to his previous level of function as quickly as possible. Which of the following approaches would be most effective in supporting Mr. Davis's recovery and emotional well-being? A. Recommending that Mr. Davis focus exclusively on regaining his ability to walk and delay working on other activities. B. Providing encouragement and realistic goals, incorporating adaptive equipment and involving him in task training for all aspects of daily living. C. Telling Mr. Davis that complete independence is unlikely and that he will need long-term support for basic tasks. D. Suggesting that Mr. Davis take break from rehabilitation and focus on rest to regain strength. Answer B. Providing encouragement and realistic goals, incorporating adaptive equipment, and involving him in task training for all aspects of daily living. Explanation. Setting realistic goals and providing a balanced approach that includes walking, dressing, and other activities of daily living will help Mr. Davis regain a sense of control and improve his functional independence. Adaptive equipment, along with encouragement and task-specific training, help him work toward his recovery without unrealistic expectations. Option A may limit his progress in other important areas of daily life and doesn't address his full range of needs. Option C is demotivating and promotes learned helplessness, which can hinder his emotional recovery and overall progress. Option D may delay his progress and is not in line with rehabilitation goals, which emphasize active participation. Question 17. Ms. Roberts is a 40-year-old woman who recently experienced a traumatic brain injury (TBI) in a car accident. She has been experiencing difficulty with memory, concentration, and executive function. Ms. Roberts is concerned about her ability to return to work and manage her household responsibilities. Which of the following interventions would be most helpful in addressing Ms. Roberts's cognitive challenges? A. Recommending complete rest from any cognitive tasks to allow her brain to heal. B. Providing cognitive rehabilitation therapy, including memory aids, strategies for improving concentration, and task management techniques. C. Encouraging Ms. Roberts to return to work immediately without any accommodations to challenge her cognitive abilities. D. Suggesting that Ms. Roberts take long-term leave of absence from work and rely on members for all household tasks. Answer B. Providing cognitive rehabilitation therapy, including memory aids, strategies for improving concentration, and task management techniques. Explanation. Cognitive rehabilitation therapy is critical for individuals recovering from traumatic brain injuries. Memory aids, e.g., calendars, reminders, strategies for improving concentration, and task management techniques can help Ms. Roberts adjust to cognitive challenges and independence. A gradual return to work with appropriate accommodations will also support her recovery. Option A is too restrictive and may delay recovery by avoiding cognitive engagement. Option C may overwhelm her and hinder her ability to manage her symptoms effectively. Option D limits her independence and does not promote recovery through rehabilitation. Question 18. Mr. Fisher is a 65-year-old man with Parkinson's disease who is experiencing difficulty with balance, gait, and fine motor coordination. He enjoys playing golf but is finding it increasingly difficult to participate due to his symptoms. He is seeking ways to remain active without exacerbating his condition. Which of the following interventions would be most beneficial in supporting Mr. Fisher's participation in golf? A. Advising Mr. Fisher to stop playing golf altogether to avoid falling or injury. B. Encouraging Mr. Fisher to play golf as regularly as possible, even without any accommodations, to maintain his function. C. Recommending modifications to his golf equipment, gait training, and fall prevention program to support his continued participation. D. Suggesting that Mr. Fisher focus on seated activities and avoid any standing or walk, reduce his fall risk. Answer C. Recommending modifications to his golf equipment, gait training, and a fall prevention program to support his continued participation. Explanation. Modifications to equipment, e.g., a more stable golf club or cart, gait training, and a fall prevention program will enable Mr. Fisher to continue enjoying golf while minimizing risks. Adaptive techniques and rehabilitation programs that target balance and coordination help him safely engage in the sport and maintain his quality of life. Option A would unnecessarily restrict Mr. Fisher from enjoying an activity that is meaningful to him. Option B could lead to unsafe participation without addressing his symptoms or providing accommodations. Option D would limit his mobility and quality of life, preventing him from engaging in physical activities like golf that are beneficial for overall well-being. Question 19. Ms. Johnson is a 30-year-old woman who has recently been diagnosed with rheumatoid arthritis (RA). She experiences pain and stiffness in her hands and knees, particularly in the morning, and is concerned about how her condition will affect her ability to continue working as a graphic designer. Which of the following interventions would be most appropriate to help Ms. Johnson manage her condition and maintain her career? A. Recommending complete bed rest to reduce inflammation and avoid stress on her joints. B. Suggesting a combination of joint protection techniques, ergonomic workstation adjustments, and an exercise program tailored to her needs. C. Encouraging MS Johnson to push through the pain and continue her work without any modifications. D. Advising MS Johnson to reduce her working hours and limit any physical activities outside of work. Answer: B. Suggesting a combination of joint protection techniques, ergonomic workstation adjustments, and an exercise program tailored to her needs. Explanation: for individuals with rheumatoid arthritis, joint protection techniques, e.g., using assistive devices, ergonomic workstation modifications, e.g., keyboard positioning, and a tailored exercise program, e.g., strengthening and flexibility exercises, can help manage, prevent further joint damage, and maintain functionality. This holistic approach supports both her career and overall health. Option A is not appropriate because complete rest may lead to further stiffness and deconditioning. Option C could lead to further damage and pain, which may hinder her ability to continue working. Option D is overly restrictive and may not be necessary if proper modifications are in place. Question 20. Mr. Patel, a 55-year-old man, has recently undergone knee surgery following an accident. He is in the early stages of rehabilitation and is experiencing pain and difficulty with weight-bearing activities. He wants to return to his job as a construction worker, but is concerned about the impact of his injury on his ability to perform physical tasks. Which of the following interventions would best help Mr. Patel return to work while continuing his rehabilitation? A. Recommending that Mr. Patel take a long-term medical leave to avoid strain on his knee. B. Encouraging Mr. Patel to return to his full workload immediately to regain strength and mobility. C. Implementing a phased return to work with accommodations such as lighter duties and physical therapy sessions. D. Suggesting that Mr. Patel remain completely inactive until he is pain-free before attempting any work tasks. Answer: C. Implementing a phased return to work with accommodations such as lighter duties and physical therapy sessions. Explanation: a phased return to work is the best approach as it allows Mr. Patel to gradually ease back into his role while continuing rehabilitation. This could involve lighter duties and regular physical therapy sessions to strengthen his knee and ensure safe participation in his job. It also prevents overloading the knee, reducing a further injury. Option A may be too restrictive and unnecessary if proper accommodations are made. Option B could lead to re-injury or exacerbate his condition. Option D would delay his return to work unnecessarily and is not a productive approach to rehabilitation. Question 21. MS Thompson is a 45-year-old woman who has recently been diagnosed with multiple sclerosis (MS). She experiences episodes of weakness, fatigue, and balance problems, but she is determined to maintain her independence and quality of life. She is seeking advice on how to manage her symptoms and remain active. Which of the following interventions would be most beneficial for MS Thompson? A. Recommending complete bed rest during flare-ups to conserve energy and avoid exacerbating her symptoms. B. Encouraging MS Thompson to engage in regular physical activity, including low-impact exercises like swimming or walking, and educating her about energy conservation techniques. C. Suggesting that MS Thompson avoid any physical activity and focus solely on managing her symptoms with medication. D. Advising MS Tom stop working and reduce her activities until she experiences a remission of symptoms. Answer: B. Encouraging MS Thompson to engage in regular physical activity, including low-impact exercises like swimming or walking, and educating her about energy conservation techniques. Explanation: physical activity, including low-impact exercises like swimming or walking, is highly beneficial for people with multiple sclerosis (MS). These activities improve strength, balance, and overall function. In addition, energy conservation techniques, g. pacing, prioritizing tasks, can help MS Thompson manage fatigue and maintain her independence while living with MS. Option A is not ideal as it encourages inactivity, which can lead to deconditioning and worsen symptoms. Option C overemphasizes medication without considering the benefits of physical activity and lifestyle modifications. Option D is too restrictive and does not promote maintaining independence or engaging in activities that can help manage MS. Question 22. Mr. Hernandez is a 68-year-old man who has recently been diagnosed with chronic obstructive pulmonary disease (COPD). He is experiencing shortness of breath, especially with exertion, and is struggling to maintain his usual activity levels. He is concerned about the impact of his condition on his ability to continue working as A taxi driver, which of the following interventions would be most helpful in managing Mr. Hernandez's symptoms and supporting his ability to work? A. Recommending that Mr. Hernandez stop working immediately and focus on medication management. B. Encouraging Mr. Hernandez to engage in pulmonary rehabilitation, including breathing exercises and gradual increase in physical activity, while making adjustments to his work schedule. C. Advising Mr. Hernandez to limit all physical activity and rest as much as possible to avoid worsening his condition. D. Suggesting that Mr. Hernandez take leave of absence from work and focus solely on oxygen therapy. Answer: B. Encouraging Mr. Hernandez to engage in pulmonary rehabilitation, including breathing exercises and a gradual increase in physical activity while making adjustments to his work schedule. Explanation: Pulmonary rehabilitation is an effective intervention for managing COP. It includes breathing exercises, strength training, and gradually increasing physical activity to improve endurance and reduce symptoms of shortness of breath. Adjusting work schedule to reduce exertion and incorporate rest breaks can help Mr. Hernandez continue working while managing his condition effectively. Option A may be too restrictive and may result in a loss of independence. Option C may lead to deconditioning, worsening his symptoms over time. Option D focuses only on one aspect of treatment, oxygen therapy, and does not provide a comprehensive approach. Question 23. Mrs. Larson is a 70-year-old woman with osteoporosis who has recently experienced a mild spinal fracture. She is concerned about falling and is seeking advice on how to improve her bone health and prevent future fractures. Which of the following interventions would be most beneficial in reducing Mrs. Larson's fall risk and improving her bone health? A. Recommending that Mrs. Larson avoid all physical activity to prevent any risk of injury. B. Encouraging Mrs. Larson to participate in weight-bearing exercises. E.g. walking light strength training while also ensuring a safe home environment and fall prevention measures. C. Suggesting that Mrs. Larson focus only on dietary supplements for bone health and avoid exercise. D. Advising Mrs. Larson to limit her mobility to the chance of falling. Answer: B. Encouraging Mrs. Larson to participate in weight-bearing exercises. E.g. walking light strength training while also ensuring a safe home environment and fall prevention measures. Explanation: Weight-bearing exercises like walking and light strength training are essential for improving bone density and reducing the risk of further fractures. In addition, ensuring a safe home environment, e.g. removing tripping hazards and using prevention strategies, can help minimize her fall risk. Option A is detrimental because inactivity can lead to muscle weakness and increased fracture risk. Option C overlooks the importance of physical activity, which is key to managing osteoporosis. Option D would restrict her mobility and reduce her quality of life without addressing the underlying issue of bone health. Question 24. Mr. Davis, a 50-year-old man, is recovering from a heart attack. He has been cleared by his doctor to return to work, but is concerned about how to manage his physical activity levels to avoid overexertion. He works as a truck driver, which requires long hours of sitting but occasionally involves unloading heavy goods. Which of the following interventions would best help Mr. Davis return to work safely? A. Recommending that Mr. Davis remain at home and limit all physical activity until he feels completely symptom-free. B. Encouraging Mr. Davis to start with light duties, such as driving with minimal stops, while slowly increasing his activity level and avoiding heavy lifting. C. Advising Mr. Davis to return to his normal work routine immediately, since he has been medically cleared for work. D. Suggesting that Mr. Davis avoid any activity at work and request permanent desk job position instead of driving. Answer: B. Encouraging Mr. Davis to start with light duties, such as driving with minimal stops, while slowly increasing his activity level and avoiding heavy lifting. Explanation: After a heart attack, a gradual return to work is important to avoid overexertion and prevent further health complications. Mr. Davis should ease back into his duties, starting with light tasks and slowly building up his activity levels. Option A is too restrictive and could lead to a loss of independence. Option C could be risky without a gradual adjustment to work demands. Option D suggests an unnecessary change in job duties and overlooks the benefits of a phased return. Question 25. MS Walker, a 40-year-old teacher, has recently been diagnosed with fibromyalgia. She experiences chronic widespread pain, fatigue, and sleep disturbances, which make it challenging for her to keep up with her work schedule. Which of the following strategies would best help MS Walker manage her symptoms and maintain her teaching career? A. Recommending that MS Walker reduce her working hours and take extended time off to manage her pain. B. Encouraging MS Walker to implement a flexible work schedule with breaks for rest and incorporate stress-reducing techniques such as deep breathing exercises during the day. C. Advising MS Walker to avoid any physical activity, including classroom movement, to prevent worsening her condition. D. Suggesting that MS Walker teaching entirely and pursue a less physically demanding career. Answer B. Encouraging MS Walker to implement a flexible work schedule with breaks for rest and incorporate stress-reducing techniques such as deep breathing exercises during the day. Explanation: for individuals with fibromyalgia, managing symptoms involves a balanced approach that includes stress management, breaks for rest, and a flexible schedule. Encouraging MS Walker to adjust her work routine while promoting relaxation techniques to help her stay productive without exacerbating her symptoms. Option A could be too restrictive and may not be necessary with proper adjustments. Option C is counterproductive, as mild physical activity can help manage symptoms of fibromyalgia. Option D is unnecessary and doesn't promote the use of modifications that could allow MS Walker to continue working. Question 26. Mr. Clark, a 60-year-old man, has recently had a hip replacement surgery. He is eager to return to his job as a warehouse supervisor, but is concerned about how to safely engage in physical activities such as lifting, walking, and climbing stairs. Which of the following interventions would best help Mr. Clark return to work safely and prevent complications? A. Encouraging Mr. Clark to refrain from any physical activity and request a sedentary role until he is fully healed. B. Advising Mr. Clark to use proper lifting techniques, gradually increase his physical activity, and consult with his doctor before resuming more strenuous tasks. C. Suggesting Mr. Clark return to work immediately and resume all physical tasks without restrictions. D. Recommending Mr. Clark take an extended absence to ensure full recovery before returning to work. Answer: B. Advising Mr. Clark to use proper lifting techniques, gradually increase his physical activity, and consult with his doctor before resuming more strenuous tasks. Explanation: after a hip replacement, gradual increases in physical activity, proper lifting techniques, and clear communication with the doctor are essential to safely returning to work. This approach ensures that Mr. Clark's recovery continues while preventing re-injury. Option A is overly restrictive and unnecessary, as Mr. Clark can return to work with proper accommodations. Option C could lead to complications or injury due to lack of proper recovery. Option D is unnecessary if proper precautions are taken during the return to work process. Question 27. MS. Garcia, a 35-year-old administrative assistant, has been diagnosed with carpal tunnel syndrome. She experiences numbness and tingling in her hands and wrists, especially after long periods of typing. Which of the following interventions would be most helpful in managing MS? Garcia's condition and allowing her to continue working. A. Recommending the MS. Garcia avoid using the computer entirely for the next few weeks. B. Suggesting the MS. Garcia adjust her workstation ergonomically. Take frequent breaks and incorporate wrist exercises to alleviate symptoms. C. Advising MS. Garcia to take a leave of absence from work to focus on therapy and recovery. D. Encouraging MS. Garcia to push through the discomfort and continue working with modifications. Answer: B. Suggesting the MS. Garcia adjust her workstation ergonomically, take frequent breaks, and incorporate wrist exercises to alleviate symptoms. Explanation: ergonomic adjustments to the workstation, such as proper keyboard positioning, wrist support, and regular breaks, can help manage carpal tunnel syndrome. Additionally, wrist exercises can promote recovery and reduce symptoms. Option A may be too restrictive, and avoiding the computer is not necessary with proper modifications. Option C could be avoided if adjustments are made to her work environment. Option D could worsen her condition by encouraging continued strain on her wrists. Question 20. Mr. Nelson, a 45-year-old factory worker, has been diagnosed with asthma. He experiences shortness of breath, especially when exposed to dust and chemicals in his work environment. He is concerned about the impact of his asthma on his ability to continue working. Which of the following strategies would best help Mr. Nelson manage his asthma and stay employed? A. Recommending that Mr. Nelson stop working in the factory and find a job in a dust-free environment. B. Encouraging Mr. Nelson to use his inhaler regularly, wear a mask to reduce exposure to dust, and request modifications to his work environment. C. Suggesting Mr. Nelson take a leave of absence until his asthma symptoms completely resolve. D. Advising Mr. Nelson to continue working without modifications and only use inhaler during severe attacks. Answer: B. Encouraging Mr. Nelson to use his inhaler regularly, wear a mask to reduce exposure to dust, and request modifications to his work environment. Explanation: for individuals with asthma, managing the condition involves regular medication use, reducing exposure to triggers such as dust, and requesting workplace modifications to create a safer environment. These steps allow Mr. Nelson to continue working while minimizing attacks. Option A may not be necessary if modifications are made to his work environment. Option C is too restrictive and not necessary if proper accommodations are made. Option D may not be sufficient as proactive management of asthma is crucial. Question 29. MS Rodriguez, a 28-year-old office worker, has been diagnosed with a herniated disc in her low back. She experiences pain and stiffness after prolonged sitting at her desk. Which of the following interventions would best help MS Rodriguez manage her condition and continue working? A. Recommending that MS Rodriguez stop sitting at her desk entirely and work from home. B. Encouraging MS Rodriguez to incorporate standing breaks to adjust her chair and desk for better posture and participate in physical therapy for strengthening exercises. C. Advising MS Rodriguez to take a leave of absence until her pain is completely gone. D. Suggesting that MS Rodriguez avoid any physical activity and focus on medication management. Answer: B. Encouraging MS Rodriguez to incorporate standing breaks, adjust her chair and desk for better posture, and participate in physical therapy for strengthening exercises. Explanation: incorporating breaks for standing or walking, ergonomic adjustments to the workstation, and physical therapy for strengthening and flexibility can help manage the symptoms of a herniated disc while allowing MS Rodriguez to continue working. Option A is unnecessarily restrictive and does not address the underlying issues. Option C is overly cautious and may delay her recovery unnecessarily. Option D overlooks the importance of physical activity and posture adjustments in managing back pain. Question 30. Mr. Simmons, a 52-year-old electrician, has been diagnosed with early-stage Parkinson's disease. He experiences tremors and difficulty with fine motor tasks, such as handling small tools. He is concerned about how his condition will affect his ability to continue working. Which of the following strategies would best help Mr. Simmons manage his condition and remain employed? A. Recommending that Mr. Simmons take early retirement due to his Parkinson's diagnosis. B. Encouraging Mr. Simmons to work with an occupational therapist to develop strategies for managing tremors and adapting his work tasks to reduce fine motor demands. C. Suggesting that Mr. Simmons stop using his hands for any tasks and request purely supervisory role. D. Advising Mr. Simmons to ignore the tremors and continue working, making any modifications to his work tasks. Answer: B. Encouraging Mr. Simmons to work with an occupational therapist to develop strategies for managing tremors and adapting his work tasks to reduce fine motor demands. Explanation: an occupational therapist can help Mr. Simmons develop strategies to manage his tremors and adapt his tasks to make them more manageable. This approach allows him to continue working while minimizing the impact of Parkinson's disease on his performance. Option A is premature and doesn't consider accommodations that could allow Mr. Simmons to continue working. Option C may be unnecessary, as modifications to his role may be enough to enable him to continue. Option D could exacerbate his symptoms and compromise his safety at work.